Hi, I'm BBV, aka also known as infected hepatitis C. BBV, blood-borne viruses. Right, here we go. I started taking drugs when I was 13 years old. I grew up with it around me because my parents were from out the 60s. And my mum even told me that I was in a room at the Isle of Wight festival. So, anyway, I managed to dodge blood-borne viruses for over 20 years of using drugs. The first time I got tested, the doctor got my microbiologist report wrong, and I had to go on the phone in the doctor's surgery, which was very terrifying because I was holding on to my seat for the results, to be told that I was Hep B and I was infected and it wasn't going to go. I waited 6 months and the virus went and I had my own antibodies. I didn't really have a go at the doctor, I just moved to another surgery. I've been in Brighton for 12 years. Just before I came into Brighton, I was living in Hastings. I had used an infected needle before I came over to the south. I waited 3 months, went to the doctors in Hastings, holding on to the seat again, and I was told I had hepatitis C. If I'd stayed in that area, I would have been working with a hospital like I am here. I'm an outpatient at the Sussex with the liver and digestives. Hepatitis C, I've got chronic active hepatitis C, genotype 2 and genotype 3. I've had that for over a decade and I am awaiting treatment. I get tired all the time, feel sick, sweat, out of breath, flu-like, memory loss, brain fog, IBS, all sorts of different ailments, and health ruins me. Sometimes I just can't even go out and face the world. It affects your diet as well, and your lack of sleep. I like to say, if anyone's out there and they're sharing equipment, it gets worse. My best friend has HIV, he's co-infected with hepatitis C. Some time ago, before he had a job, we were sharing, after hanging around together for 3 months, I gave him pneumonia. Our different strengths of hepatitis were sharing equipment. It is more likely that you're going to catch hepatitis from used needles or equipment than HIV. I'm lucky I'm not infected like my friend. He's got a normal life now and he's got a job. I asked if I could have permission to talk about this, to share experiences. Basically, it's blood to blood from needle and equipment. You are going to catch hepatitis. Hepatitis B, hepatitis C, and there's A. I've had my shots for A, and hepatitis B, there's nothing they can do because I've got my own antibodies and I'm not a carrier. So, but also I noticed another thing is the genotypes to get them treated. Genotype 2 and genotype 3 are the easy ones to cure. Geno 1 and Geno 4 are unsuccessful. I think mine's an 89% chance that I will clear this when I get my interferon treatment, which is a cancer drug which is intravenous into the stomach muscles. But I don't like that idea, and I know that they've got other treatments out there, so I'm stalling my treatment.